guest, Dr. Arpita Tembhurnikar ma'am. Very warm welcome to our today's guest, Dr. Arpita Tembhurnikar madam. It's my pleasure from Women's Development Cell that I got this opportunity to introduce our chief guest. Dr. Arpita madam has completed her Bachelor of Homeopathy and Medical Sciences from MUHS Nashik and registered as homeopathic practitioner, and she is working from 11 years as medical assistant in Kelkar Hospital, Bhusawal. In this duration, she has performed number of responsibilities. She has uh, completed her coursework in gynecology and obstetrics, as well as she has completed her coursework in skin disease also from Mumbai Institute. So, welcome, ma'am. It's our pleasure that here our students will get.
Yeah, thank you, ma'am.
Dear NDLI Club members, I would like to congratulate you for arranging such continuous programs which are helpful for our girl students. I am also thankful to Dr. Arpita Tembhurnikar for sparing his valuable time for this today's program. Thank you, ma'am, and over to you.
Thank you, sir. Respected Principal, Dr. Bajibe sir, and Dr. S.M. Shinde ma'am, all the faculty members and the students present here, hearty good morning to all of you. First of all, I would like to thank Bajibe sir and Sulbha Shinde ma'am specially for inviting me to talk on this platform. Today, I'm here to interact with all of you on the topic of feminine hygiene and health. Before moving on the topic, as Neeta ma'am told, that I have completed my graduation in homeopathic medicines, and I have specialized in especially ops and gynec with the help of Dr. Kelkar ma'am and Dr. Ashutosh sir, who have enlightened and shared their knowledge with me from the past 11 to 12 years, because of which today I'm capable to discuss with you and share my experience on this topic. So, without any further ado, I would like to start the session. Actually, yeah. Okay. Okay. Yeah. So, a woman's life is divided into 4 phases. The first is adolescence. The first is adolescence, in which I guess many of you are going through this teenage means transition period from the teenage to the adulthood, in which number of body changes, hormonal changes occur, and which is difficult to share to someone. In this period, we have irregular cycle of menses, means irregular blood flow. So, what is irregular blood flow? For that, you should know the regular cycle of the periods. Originally, our menses occur at 28 days cycle, and plus minus 7 days are also normal in that. means a cycle ranging from 21 days to 35 days is considered as normal. And if your periods are occurring every 15 days or at the interval of 1.5 to 2 months, then it is worrisome. So you should report immediately to the gynec or female doctor for the regularization of your periods. Second, heavy bleeding or scanty flow. These both are also abnormal. And too much of dysmenorrhea. In today's hectic life, majority of the girls are suffering from PCOD. So this is also a very common thing which we are seeing in nowadays. And PCOD is generally due to stress and lifestyle modifications are too much necessary to correct this condition. Then the second half of our female life, that is midlife. In this, fertility issue is too much seen nowadays. Irregular and excessive blood flows, fibroids, adenomyosis is generally seen in this stage of life. Then the third phase is menopause. Through this phase, every woman has to go. And the symptoms seen during this phase is lethargy, mood swings, hot flushes, and generally calcium deficiency. After the menopause is attained, the woman generally feels that now everything is normal as the periods have gone, but it's the wrong conception. After the menses have gone, you should take special care of yourself and do regular health checkups, regular testing about your gynec related organs. You should do breast checkup by yourself, do pap smears and a small mammography test after every 3 to 4 years to rule out the cancer, which is more popular and more common to hear nowadays. And the next topic is hygiene. Hygiene is nothing but to prevent ourselves from getting regular and repeated infections, as the female genital organs generally are too much moist and damp. So you should clean and keep the vagina dry, change pads regularly, as wetness may increase regular infections, and repeated infections leads to uh, break up the confidence of the females. So it is too much necessary that you should pay special attention to your health and hygiene related issues. Always wear light undergarments, breathable clothes, change your menstrual products regularly, keep your genitalia clean, drink enough liquids, and in case of dysmenorrhea, you can use hot compressions over the cramp zone. Nowadays, heating pads are also available. Eat healthy food and take antispasmodics in case of dysmenorrhea. And especially after 40s, you should take supplementation of multivitamins, calcium, and do yoga regularly so that you can maintain your health with the uh, with the help of yoga. You can keep your mental and physical health balance in the life. If any further questions, you can ask me related on this topic.
Any questions from girl side? Ma'am, one question is from my side.
Yeah.
About menstrual problems. So many girls facing in this teenage about the menstrual problems. So tell something about PCOD.
Yeah. PCOD is a condition in which too much underdeveloped follicles develop in our body. The regular function of an ovary is to develop one follicle in 1 month. And in PCOD, too much immature follicles are developed at a time, due to which we do not get the periods at regular interval. So this is a condition which occurs due to unhealthy lifestyle, unhealthy eating habits, lack of exercise, and too much stress, which is too much common in nowadays. So to correct this, you have to have healthy lifestyle, eat proper food, do proper exercises, and stress cannot be changed. So you have to tackle the stress.
Ma'am, girl side, raise your hands and ask your question. Yes, Harshila, continue.
Good morning, ma'am. Ma'am, I would like to ask question about more about menstrual problem like PCOD.
Yeah, as I previously told, PCOD is not a disease. It is a condition which is commonly seen due to irregular lifestyle, eating habits, and sleep disorders. So you have to tackle this condition by keeping yourself healthy, eating food that is homemade, take protein rich diet, and consult a gynec if you are having too much problem related to this.
Yes, ma'am. Okay, ma'am. Thank you.
Girls, first raise your hand and ask your question.
Hello, ma'am. Hello.
Yes, sir.
Hello, ma'am. Myself Sakshi Dongde, and my question is, what is the difference between and which is the best use of sanitary napkins and menstrual cups?
Both the options are nowadays very good, but personally I think menstrual cups are more comfortable, as it is easy to use and it reduces the pollution. uh, but if you are uncomfortable by using this menstrual cups now, so you can go to a gynec and she will access the pelvic size and she will accordingly tell you that which menstrual cup is comfortable and which is correct to your according to your need, and she will tell you how to use.
Okay, ma'am.
Any questions? Yes, Sakshi,
Ma'am,
continue.
ma'am, I have to ask a question. Ma'am, what are the cause of repeated UTI in female?
When you will see the anatomy of the female genital organ, the urethral opening, vaginal opening, and the anal opening are too much in close proximity to one another, and the size of the female urethra is too short. This is the main reason why we get repeated UTI. So to prevent repeated UTI, whenever you use public toilets, always flush the toilets and then to use it. Then secondly, you should avoid using Western toilet in public places. You should use Indian toilet, and whenever you come home, change the undergarments, use V wash or fair wash, the vaginal washes, and drink plenty of water. And in case if you have repeated UTI, you should improve your body's immunity first, because lack of immunity can be the a main reason to get repeated UTIs.
Okay, ma'am. Thank you, ma'am.
Welcome.
Hello, ma'am. Can can we stop for 1 minute
Yeah.
for national anthem?
Yes, yes.
Hello, ma'am. Hello. Yeah, ma'am. We can. Hello. Hello. Yes, ma'am. We can continue.
My side, that what
endometrial biopsy is nothing but small piece from the endometrial lining is taken, and we see whether the benign or malignant changes are taking place in that cells. And the third is mammography. It is nothing but a combination of sonography and X-ray, in which the cells of the breast are examined, that whether it is normal or whether it is going in some malignancy changes.
Thank you, ma'am. Thank you, ma'am.
Well,
Any questions from girl side?
Hello,
Yes. Yes.
ma'am. I want to ask one question.
yes, you can ask.
Ma'am, hello. Myself, Trupti Vakurkar. I want to ask that what is the reason behind the less bleeding and what should we take about this? It is affected our body.
Can you please repeat the question?
Ma'am, what is the reason behind the less bleeding during periods? It is affected our body or what should we take?
Uh, are you getting less periods from early or from now past recent day?
Past recently.
Okay, earlier it was normal.
Yes.
Yeah, so it can be due to the polycystic ovary also. So you should consult the doctor and undergo a sonography, which will help, and it will give you some hormonal therapy also, so that the increase and regular blood flow will be there.
Okay. Okay, ma'am.
Any questions from girl side?
Hello, ma'am.
Yes, Sakshi.
Ma'am, one more question is what is the environmental impact of single-use disposable and tampons, pads and tampons?
I'm not I'm unable to get the question. Can you please repeat the question?
Yes, ma'am. The question is what is the environmental impact of single-use disposable pads and tampons?
Environmental environmental effect. Definitely the tampons and this menstrual pads, they lead to the pollution, because the plastic material, when we use and when we dispose of, that create harmful effects on the pollution. So instead of using that plastic coating menstrual pads, you can use cotton pads, and read the instructions before the disposal on the sanitary napkins. Generally people flush it and throw it, so you don't have to flush it. You should throw by wrapping it dry only within the paper.
Okay, ma'am. Thank you.
And one question. Counseling before marriage regarding family planning or conceptions.
Yeah, nowadays many people means in our practice we see that during their education period only they get married, and after that they come to our place for medical termination of pregnancies. And when you firstly conceive and you undergo the medical termination of pregnancy, it has adverse effects on the body. So if you're getting married during the education period, you should prior come to the doctor and seek some advice regarding the use of copper teas or OC pills. And you should avoid the pregnancy till the time you don't need it. And when you're trying to plan, you should come for the you should come to the doctor regarding the information of folic acid supplementation prior to conceiving only. मीन्स मी तुम्हाला एक मराठीत सांगते की जर तुम्ही आधीपासून म्हणजे प्रेग्नन्सीच्या 3 महिन्या आधीपासून जर फोलिक ऍसिड घेतले दोघांनी, हजबंड आणि वाईफ, तर जे न्यूरल ट्यूब डिफेक्ट्स आणि खूप जास्त रिपीटेड अबॉर्शन जे आपल्याला आजकाल दिसायला भेटतंय ते होणार नाही. म्हणजे हेल्दी एक आउटकम भेटणार आणि थोडं लेस मेंटल स्ट्रेस होणार, बोथ कपल्सवर पण आणि फॅमिलीवर पण.
Thank you, ma'am.
Yes, any question from girl side? Hello? Anybody wants to ask any question?
No, ma'am.
Okay. कोई नहीं पूछ रहा है तो अभी.
Here I will say that no questions from girls. So we will conclude here. Thank you very much, Dr. Arpita ma'am. First of all, I will say thank you to our Honorable Principal, Dr. RB sir, for giving us opportunity and let us arrange very knowledgeable session for our girls. Then I am again thankful to Dr. Arpita Tembhurnikar ma'am. She has taken her precious time and give a knowledgeable session on such very important topic to our girls. Again, I will thank to our chairperson, Dr. SM Shinde madam, for arranging such session for girls. And thanks to all the participants. And thanks to all the member of our WDC cell. Thank you very much.
Thank you, ma'am. Thank you.